Okay. So for those of that don't know who I am, my name is Sherelle. I have been a registered nurse for 25 years. 25 years. And I have learned much. Um, I think moving forward, I'm going to start talking about things to help people when it comes to conditions dealing with the heart. Um, I am currently a triage nurse, and I'm talking to people every day, and I am finding that people know less and less and less about their condition. Not to say they don't know, meaning some people know that they have a condition, but some of the things that they do to treat the condition doesn't make quite good sense, or they're not doing the things that they need that are sensible to help them treat the problem that they have. And so what I want to start doing is talking about what people can do to help their own condition dealing with the heart. And I think I'm going to start telling some stories just to give you examples of what's going on and how you can treat your condition. You know, what do you need to do in order to take care of yourself? Because I say this all the time, and I believe it. I'm a firm believer. You are your biggest advocate, okay? You have to advocate for yourself. But in order to advocate, you got to know. You got to know your condition. You got to know the questions to ask, because you can't advocate when you don't know what to do. And since for those that have had a heart attack, for those that have angina pain, for those that have heart failure, for those that have atrial fibrillation, you got to know what to do for you, okay? This is your life. And these conditions don't mean your life is over. I will say this all the time. Does not mean that your life is over. What it means is there's some things you got to do differently in order to move forward, to help yourself. You got to help yourself. So I'm here to help any way I can, okay? As a nurse, I don't mind answering questions. I don't mind, because I do this every day. I answer questions, but I'm seeing that people have similar questions or some of the same questions. And so I want to use a little story for an example to see how I can help kind of get you on the right track, get you in the right mindset of thinking what you need to do for your health. So let's talk about chest pain, okay? A number of the calls I get is about chest pain. They call me, they say, hey, I'm having chest pain. So the questions that I will ask them is, okay, you have chest pain. Where's your chest pain located? How long have you been having chest pain? Is it a sharp pain? Is it a dull pain? Tell me what it feels like. How intense is it? And I will also ask them, pain level. What's your pain level like? Or things like, what have you done for your pain? What have you done to relieve your pain? Or what have you noticed that will relieve your pain? These are things that if you call somebody and tell them that you have chest pain, they're going to ask you these questions. So the questions that I'm asking you or saying right now is exactly what they're going to ask you. If you're speaking to a triage nurse, or if you're speaking to a call center, even 911 might ask you some of these questions because they're trying to help you. They're not trying to be nosy. They are literally trying to help you. So anything that we can do to help you is what we got to do. So first I'm going to say, I know that you're stressed out because you're having chest pain, but try to work with the people so that they can give you some information, because, and don't be so apprehensive. Don't be so standoffish. Don't be so, mad when they're asking you questions, because they're just trying to get to the bottom of it. It may be something simple. It may be something complex, but the questions are going to help guide a plan of care for you and a plan of action. Let's say that. A plan of action for you, okay? So I talked to somebody and they told me they had chest pain. They told me that they were having chest pain. It's been for 24 hours. It's been a crushing pain in the middle of their chest, and it feels like an elephant sitting on their chest. All right, well, one thing I'm going to say, anytime somebody says things like that, I'm going to tell them, you need to go to the emergency room. I'm never not going to tell you not to go to the emergency room, especially since you especially you tell me that you've never had that pain before. It's felt like something I've never felt before. I'm going to tell you to go to the emergency room. Don't get mad when just hear me out. If somebody tells you to go to the emergency room, it's for a very good reason, okay? Going to the emergency room, number one, you're going to get somebody's attention when you're saying you have chest pain, okay? It's going to cause them to do some testing. They're going to do an EKG, that's an electrocardiogram, to look at the rhythm of your heart. They need to know if it's normal. They need to know if it's abnormal. Okay, that's going to tell them some things. They're going to draw blood. All right, drawing blood, they're going to be looking for certain enzymes that your heart puts out if it's in distress. So they're going to see how distressed is your heart. They may do depending on if you have a history of heart failure, they may do a test called a BNP. Again, they're looking for certain certain enzymes, certain things that are being put out by the heart that it only happens when you have certain conditions. Okay? So they gotta do that. They have to do these things. And we have to ask you these questions, okay? After they, and then they may do an echocardiogram because they want to see, looking at the inside of your heart, they want to see how the blood is flowing. They want to see, is there any holes in the heart, any avenues in the heart that are not working properly? All of these things are just to help you. But understand, if you call a triage nurse, or if you call a nurse in a office or a facility and they tell you to go to the emergency room, expect that in the emergency room, they're going to do some testing, okay? Testing takes time, okay? If they draw your blood, they got to get the labs. They got to get the results. If they do an echo, they need results. If they do a CAT scan or put you in a machine because they need to get a better picture of what your heart is doing, it's going to take some time, okay? You're looking at, if you walk into the emergency room, from the time that they start to the time that you get enough information for answers, you're probably looking at 10 to 12 hours. Don't shoot the messenger, okay? Please don't shoot the messenger. But all of this is necessary because you need to know what's going on, all right? You got to know what's going on. Don't you want the answers? Okay? So don't get mad when I tell you to go to the emergency room. You got to go to the emergency room, all right? Now, if you tell me that you have a chest pain and you've had it for 6 months, you also tell me that you have a history of acid reflux and you just ate a big meal, and I'm still going to tell you to go to the emergency room. Like I said, I'm never not going to tell you. If I always say, if the pain gets worse, go to the emergency room, okay? I'm going to tell you these things because it's important. You got to go to the emergency room. But if you tell me you've had the same pain for 6 months and it's not an elephant sitting on your chest, but it's a burning and things like that, I'm going to help you get an appointment. Now, I might tell you, because sometimes, we know that doctor's offices, you're not getting immediate appointments these days. Sometimes appointments take a while, okay? It may take a month. I try to do same-day appointments, but I can't always do that, all right? Your clinic may not be able to do same-day appointments, okay? They may get you an appointment in a couple of weeks, but let's think about it for a second. You've had the same pain for 6 months. 2 weeks is not going to kill you, all right? If 2 weeks is going to kill you, go to the emergency room, right? If 2 weeks is going to kill you, I'm telling you now, go to the emergency room because you don't want to die. And I don't want you to die, okay? In the meantime, though, I need you to understand that it could take some time, all right? So you get your appointment. In the meantime, while you're getting your appointment, there are some things you need to do while you're in the moment of waiting. Okay, you need to have a list of your medications, because providers are going to ask you, what are you taking? Okay, and be honest about it. If you aren't taking it, say you're not taking it. Okay, if you have cardiac medications, when you call me, okay, and you tell me, and I'm going to look at your meds, going to look at your medications. If you tell me you have some chest pain going on and I see that you have nitroglycerin on your medication list, I'm going to ask you, did you take your nitro? And I certainly don't want to hear, no, well, no, I didn't take my nitro, because I'm going to tell you, take your nitroglycerin as directed. It is a standard, stick it under your tongue, wait 5 minutes, see if the pain goes away. If not, stick another dose under your tongue, wait 5 minutes, see if the pain goes away. If not, try that third dose. If the pain doesn't go away, call 911. If the pain goes away, you solve the problem. The nitroglycerin has worked. And it's to open up those blood vessels of the heart so that you can breathe. Your heart can get the nutrient that it needs, the oxygen that it needs. Mind you, you are going to have a headache, okay? Side note, please do not say, please don't call me and tell me that you have Cialis and you have Viagra and you have nitro and you decide you want to take all of those together. Don't do it. You shouldn't take it together. Before you try Cialis and before you try Viagra, you should talk to your doctor. Get medically cleared before you even start that, okay? Side note. All right. So here we are. We're looking at your meds. Another thing that I'm going to ask you, after I ask you, have you taken your medication? I'm going to ask you, are you checking your vital signs? What's your blood pressure? What's your pulse? These are standard questions. I often hear, I don't check my blood pressure. I don't check my pulse. Sometimes if you check your blood pressure and it's high, there's a direct correlation with high blood pressure and some chest pain, especially if your heart has been beating at a certain rate or your blood pressure has been high for a certain length of time. You're going to notice it's also a direct correlation with headaches and high blood pressure. If you tell me that you've had blurred vision for a while, you don't check your blood pressure, how are you going to know if your blood pressure is affecting your vision? How are you going to know if you're dizzy, if the dizziness is not because of the high blood pressure? They all go hand in hand. I would advise you to invest in a blood pressure cuff if you've been diagnosed with hypertension. Just invest in a blood pressure cuff. The Omicron, I was told by a cardiologist that Omicron is a good blood pressure cuff to try. Omnicron, Omnicrom, Omnicron, and look them up online. See how much the price is. I don't know really what the price is, but you do want to have a good blood pressure cuff. Okay. All right. And I'm going to ask, are you checking your blood pressure before or after you take your medicine? Why would I do that? Because it's important. If you check your blood pressure before and it's high, and then you don't check it after, how do you know if the medication is working? How do you know if it's helping you? If you check your blood pressure before and it's high, then you take your blood pressure medicine, and then you wait 2 hours, check it again, and it's lower. Even if it's not, even if it's gone down a few points, it's moving in the right direction, okay? Check your blood pressure. Know your blood pressure numbers. Something else I always tell people to do is write down the numbers. When you're talking to the doctor, you want the doctor to help you. If you're being an advocate for yourself, you'll write those numbers down, because when you go to see the cardiologist or the primary care, they're going to ask you, do you know what your numbers are? They're going to ask you to monitor your blood pressure. They're going to ask you for the readings. Makes no sense for you to take this good medicine, to not know if the medicine is working, to not know your numbers. Again, you're advocating for yourself, so you need to know these numbers, okay? Please, please write these numbers down. Other things that you need to do, I'm trying to remember. When you go to see your provider and you go for an annual checkup, most of the time they want you to get lab work done. They're going to tell you what lab work to get done. Get it done. Get it done, okay? We're talking about your health. We're talking about heart health. You're having good electrolytes is good for your heart. Having a good magnesium level is good for your heart. Potassium level. Potassiums, magnesiums help drive the beating of your heart. If your levels are off, the beating of your heart could be off. You could be having palpitations. You could be, your heart could be pounding. Your heart is talking to you, okay? Your heart is going to tell you what it needs. You just got to do it, okay? Another thing that I'm going to say, especially as we head into these hot months, the summer months, I know that you think that you drink a lot of water. You do. But you need more water, okay? The water that you're drinking is not enough. If you drink 8 to 10 8-ounce glass of water a day, which most Americans are living in a state of dehydration and are not doing, then you're going to need at least 4 to 6 more 8-ounce glass waters on top of what you're drinking, okay? Turn it into 3 liters. A gallon and a half might be the minimum. If you are drinking coffee and tea and soda, if you're drinking carbonated drinks, if you're drinking caffeinated drinks, you're going to affect how your heart is going to work. You're going to make your heart beat faster, and you're also going to make your heart work harder, okay? Water is the key for your heart. Water's not going to kill your heart. That's a rarity that water is the bad thing for your heart. It is the first line of defense. Drink water. Water is going to give your heart the hydration that it needs. Don't neglect your body without giving it water. When you're dehydrated, your heart is also going to beat faster. Your heart is talking to you. It says it needs water, okay? With labs, talked about labs. They do a lab to check to make sure you're not having a low blood count, to make sure that you're not anemic. All of these things are important. If you have anemia, meaning a low blood count, low blood numbers, that's going to affect your heart, because your heart oxygenates itself. It feeds itself first before it feeds the rest of your body. Your heart's going to take what it needs first. And if you have a low blood count, your heart doesn't like that. So it's going to talk to you in the form of chest pain, in the form of you being fatigued, in the form of you having shortness of breath, in the form of palpitations. Your heart is speaking. You just have to listen, okay? So these are some of the things that you need to do. Don't be mad when we say go to the hospital urgently. Don't be mad when we tell you what to do. We are triage nurses, and we're trying to give you some good advice, okay? You either take it or you don't take it, but don't get mad. Don't get on the phone and get mad. Don't get an attitude, okay? Also know yourself. If you are a person that's stressed out easily and that affects the way your heart beats, stress will affect your heart. Know that, okay? If you have anxiety issues and you know you're on medication for anxiety, take your anxiety medication before you start, noticing chest pain. Just take your medicine, okay? If you're stressed out, it's going to stress your heart out. Take your medicine. If you find that your chest pain has gone away after you took your anxiety medicine, most likely you have the answers that you need as to why your heart is, why you're having the chest pain. If you're having heartburn, take take your acid reflux medication, if you take your medication and chest pain goes away, continue to monitor yourself, continue to monitor your vital signs. But you really have your answer, okay? Always, like I said, you're your biggest advocate. You got to take care of you. There's not but one of you, okay? I'm going to say this. I need to say this, okay? There's only one of you, and you, if something happens to you, your family may be devastated, okay? I understand that you're worried about your family, your kids, your loved ones, your husband, your wife. I understand all that. But if you don't take care of yourself, you are not going to be here. And they are going to be stressed out because you're gone, okay? We don't want to stress them out, all right? So some of these things are just, do these things when you're talking to a triage nurse. Do these things for yourself. Know your numbers. Know your blood pressure numbers. A good blood pressure range is no higher than 140/90, no lower than 90/50, okay? Stay within that range. If your blood pressure is creeping up, it's going to affect your heart. If it's too low, it's going to affect your heart. You want to stay within a range. Heart rate. If your heart rate is between 100 beats per minute and 60 beats per minute, that's a good range. If it's beating at 40 and you're not a marathon runner, you don't exercise, continually all day long, something's wrong with 40 and you need to get that checked out. If you're at 40 and you are having shortness of breath, dizziness, fatigue, feeling like you're going to faint, go to the hospital. Go be seen. Don't sit around and wait. If your heart rate is too high and you can lay in the bed and hear how hard your heart is beating, do something about that as well, okay? I'm going to make this, trying to keep this very, very simple. But yeah, these are just some of the things that you need to do, all right? Care for yourself. It's time for you to put yourself at the top of the list because you've let everybody else be at the top. It's time that you take care of you now, okay? It doesn't hurt to eat healthy, have a heart-healthy diet, eat healthy, incorporate lots of vegetables, incorporate less high fat, put them chips down. You don't need them anyway. Put them down. It's high cholesterol. Put down overeating, and I can speak for overeating. Okay, we might need to eat in moderation. Okay, we may need to eat less sodium in our diet because sodium doesn't help your heart. It brings in more fluid in your body. It doesn't help for people with heart failure. It brings in more fluid and it causes your heart to have to work harder. So you got to do something to help you, okay? Now is the time. This is a very good time. 2025, very good. This is the time to start, okay? Get yourself together. If you work on your heart, maybe you can work on the rest of you. And exercise. Nothing wrong with walking, okay? Get some walking in. I don't care if you walk from the door to the driveway and you do that 10 times. And then you're able to walk from the driveway to the end of the block. And then you're able to walk from the end of the block to around the block. You got to start somewhere, okay? But put you first, all right? That's what I wanted to say. When it comes to chest pain, put yourself first. Take your medicine. Don't play around with your health, all right? You are important, all right? So this is all for now. Until the next time, all right? Bye-bye.